helping
babies
breathe.
Results of a study by the World Health Organization published in August 2011 indicates that newborn deaths account for 41% of all child deaths globally. This proportion increased from 37% in 1990. The same study reveals that newborn deaths dropped from 4.6 million in 1990 to 3.3 million in 2009. The rate of reduction is, however, slowest for those countries with the highest risk of newborn deaths, majority of which are in Africa.
Newborn care in Kenya is in what one would say deplorable state, because for more than 10 years not much has changed in terms of the death rate. Currently we are at 31 deaths per every 1,000 live births in the first 28 days of life. That translates to about 40,000 newborns dying every year in this country. That's much higher than most of the other countries in the world. Globally, we are among the 20 worst countries in terms of newborn deaths.
The statistics startled me because theoretically I've not thought that we are doing that bad on child mortality and morbidity.
Yes, the statistics indeed, to a great extent, were shocking, because my opinion was that given the fact that we are against the objective number 4 of the Millennium Development Goals, I thought that we were actually improving, but we were static. So in a sense, it means that we need to do so much in order to be where we are actually required to be, if you are to save the babies and achieve health for all.
Most newborn deaths occur at birth and within the first week of life, when coverage of care is lowest for both mothers and babies.
Most of the newborns in Kenya are dying of preventable causes. At top on the list is infections, then you have prematurity, then we have asphyxia, and then a small group from congenital abnormalities and some other general causes. So the solutions to these problems would be filling in the knowledge gap and the skills gap in terms of the newborn care. And one of them would be to train the health workers in ventilation, that is helping the babies to breathe. One of the things that the World Health Organization recommends is the use of bag and mask, which is a very cheap tool that can be affordable to all governments in the world. And programs like Helping Babies Breathe and other newborn resuscitation programs that are running under Kenya Pediatric Association do concentrate on teaching the health workers on how to help the babies breathe using the bag and mask. The other intervention is hand washing. And the Helping Babies Breathe and the newborn programs that are running, they are all emphasizing on teaching the health workers how to do proper hand washing and remembering to do that consistently.
The newborn resuscitation component within the Helping Babies Breathe training is conducted using a low-cost simulator kit that facilitates effective learning of standard newborn care and resuscitation measures. Support training materials include learner workbooks, facilitator flip chart sets, as well as wall posters available in various sizes. These training materials are available from the Ladro Foundation on a not-for-profit basis for initiatives in developing countries identified by the United Nations as focus countries for the Millennium Development Goal 4.
As a registrar of Nursing Council of Kenya, I was inspired to initiate this in-country Kenya training because I really wanted the other nurses of Kenya to learn what I had learned while I was an Addis. In the country, it may not have been possible to bring 80 nurses at a go at the Nursing Council, and yet we wanted all the nurses in the country to know what we learned, those who are in Hexacon and those who are not in Hexacon. So we really wanted to just impart what we had learned so that we don't keep it to ourselves.
Nairobi,
Lodwar Town,
Kitale Town,
Siaya,
Bomet, Embu, Karatina,
Iten, Bungoma,
Homabay,
Kapsabet, Migori Town,
Rachuonyo.
Hands-on training with the necessary basic equipment empowers health workers with the necessary knowledge and skills to provide these life-saving interventions.
So that baby has cried, eh? Yes. That baby has cried. Now you can continue. You finish and you keep the baby warm.
I'm there to prepare the tamba. Prepare to keep the baby warm.
1, 2, breathe. 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 1, 2,
Programs like Helping Babies Breathe needs to be rolled out in the in-service and the pre-service trainings, and then so that health workers can get the knowledge and the skills that have been missing in that area. And then after they are trained, there should be deliberate effort to provide those simple resources that are required. You know, having the bag and mask that is required for ventilation, having rooms where mothers can do kangaroo mother care, having rooms and spaces where mothers can do proper breastfeeding, and having health workers who are supportive to all those initiatives going on.
As in my office, our policy on CPD is very, very crucial, that we want nurses to learn and relearn, because we realize that what they learned before has changed and children keep on dying. So what is it that we can do to make children not die? In a small way, I was inspired by the fact that if we train these nurses, they go back and implement what they have learned. Perhaps one child will be saved in this county, another child in another county, and it will go a long way in helping and in imparting the training that we have had in helping babies breathe.
With this kind of new update, I believe that the number of babies who have been dying at birth can be saved, because the majority of them are dying out of breathing difficulties. So indeed the training has been very, very important in giving knowledge and also helping them to acquire skills to resuscitate the newborn at birth.
I found the training very useful, very helpful, because it has helped me particularly gather knowledge on the importance of making that baby survive within that first minute.
As a closing point, I just want to say we must help babies breathe. As nurses of Africa, let's help those babies breathe. Let's join in the team of helping babies breathe so that we train and we save the lives of those children. They don't need to die. They do not need to die. Thank you.
The Regional Center for Quality of Healthcare, Kampala, Uganda, with support and collaboration from USAID, the East Central and Southern African College of Nursing, Hexacon, the American Academy of Pediatrics, and the Ladro Foundation are working together to strengthen newborn health knowledge and skills. This is in order to contribute to the reduction of newborn mortality in the East Central and Southern African region, as well as strengthen maternal, newborn, and child health programs.